After 15 years of helping patients recover from sacroiliac joint pain without medications or surgery, I've discovered what truly works and what doesn't to eliminate back and leg pain. By the end of this video, you'll understand exactly why your SI joint hurts, the key symptoms that set it apart, and a simple 3-step method to treat and prevent sacroiliac joint dysfunction from coming back in the future. This is the same method that helped my patient Rob go from being unable to lift weights and play competitive basketball due to his SI joint pain to being completely pain-free and back on the court playing at a high level, all in just a few weeks. Hi, I'm Dr. Kevin Wafer, a chiropractor in Houston, Texas. If you're busy with work or home life and dealing with chronic spinal conditions, this channel is dedicated to you. Here you'll find exercises, expert tips, and proven strategies aimed at managing and preventing back and neck pain so you can stay active and pain-free. Before we dive in, make sure to subscribe to my channel if you want more tips and strategies to help you achieve lasting relief, improve your mobility, and regain control of your life, all without relying on medications or surgery. First, let's go over the common causes as well as some hidden causes of SI joint dysfunction and pain. We'll start with the common causes of SI joint pain. Number 1 is repetitive strain or overuse. So activities that involve repetitive bending or twisting or even lifting can cause a constant strain on the SI joint. This can eventually lead to inflammation and eventually pain. Number 2 is poor posture. So sitting or even standing for prolonged periods with poor posture can misalign the pelvis. This eventually stresses the SI joint and can cause discomfort. Number 3 is a trauma or an injury. So direct injuries like a fall or a car accident can damage the ligaments or cause instability in the SI joint, which leads to pain. And now let's discuss 3 hidden causes of SI joint pain. Number 1 are muscle imbalances. So tight or weak muscles around the hips and lower back, such as the hip flexors or the gluteal muscles, can create abnormal stress and movement patterns in the SI joint. These muscle imbalances may not be immediately obvious, but can play a significant role in SI joint pain. Number 2 is a sedentary lifestyle. Lack of movement or prolonged sitting weakens those supporting muscles around the SI joint. This reduces stability and can increase the risk of SI joint dysfunction. Number 3 is an anatomical leg length discrepancy. So a difference in leg length, even just a few millimeters, can alter gait mechanics and lead to imbalanced forces on the SI joint, eventually causing pain. At my office, we almost always take a specific leg length x-ray on our patients with SI joint pain to determine definitively if they have one leg that's naturally longer or shorter than the other. Next, let's discuss the key symptoms that set SI joint pain apart from other lower back and leg conditions. A hallmark symptom that sets SI joint pain apart from other forms of back pain is localized tenderness directly over the SI joint that can often be felt in the buttocks or even the lower back. Unlike other types of back pain, SI joint pain often causes a sharp or a dull ache that may radiate into the buttocks, groin, or down the back of the thigh, but it will rarely go past your knee. Pain is typically worse when moving from sitting to standing, climbing stairs, or when putting uneven pressure on one leg or the other. This pattern differentiates itself from other causes of sciatica or lumbar spine issues, which often involve pain that travels below the knee and are less localized to the SI joint. Have you noticed any of these symptoms in your experience? Let us know in the comments below. Why does SI dysfunction hurt so much? The sacroiliac joint is incredibly sensitive because it has a rich supply of nerves, which means any irritation or inflammation in the area can lead to tense pain. Since the SI joint supports much of your body weight, especially during movement, even slight misalignments can cause significant inflammation, making every step, twist, or bend painful. Additionally, SI joint dysfunction often results in referred pain, where discomfort radiates into the lower back, buttocks, or legs, which makes the pain feel widespread and even more severe. What disabilities are caused by SI joint dysfunction? SI joint dysfunction can limit mobility, making it difficult to walk, climb stairs, or even transition from sitting to standing. This pain during weight-bearing movements often leads to shuffling gait or balance issues. Many people often struggle to sit or stand for long periods without increased pain, which can affect the ability to walk, drive, or even participate in social activities. Everyday tasks like bending, lifting, or even simple chores become challenging, leading to reduced quality of life and diminished independence. How has SI joint dysfunction impacted your daily life and the activities you used to enjoy? Let us know in the comments below. So now let's dive into my simple 3-step approach to treating SI joint dysfunction and making sure it doesn't return in the future. Step number 1 is going to be finding the root cause of your SI joint dysfunction. And the way we do that is going to be a consultation, examination, and x-rays of your spine and pelvis. So we'll start with a full consultation. We'll ask you a lot of questions about when your pain started, where you feel the pain, how long it's been going on, does it radiate down your leg, any activities that may make your pain worse. All this is important for me to determine if in fact your pain is coming from the SI joint. Now, after we do a consultation, we'll do a full examination where I'll test your range of motion. I'll do orthopedic testing that may exacerbate your pain, but all of this is going to give me information to tell me exactly where your pain is coming from and if it's coming from the SI joint. And after we do the consultation and examination, we'll take some x-rays of your spine and pelvis, and then I'll do some detailed analysis of your x-rays that tell me how your pelvis is misaligned, whether your problem is coming from your pelvis, whether it's coming from your sacrum. And then based on this x-ray analysis, we're going to do specific chiropractic adjustments to correct pelvic or sacral misalignments that are leading to your SI joint pain. So that's step number 1. Step number 2 is we want to treat your inflammation. And we're going to do that in 2 separate ways. One, in the office, we're going to use a therapy called electric muscle stimulation. So what electric muscle stimulation does is you'll feel some tingling that goes into the muscles of your lower back and glutes. This just helps kind of relax the muscles, it helps promote blood flow into the area, which is going to help reduce inflammation. And then at home, I'm going to recommend icing for 15 to 20 minutes, at least 2 to 3 times a day. What ice will do is going to help shrink blood vessels, it's going to help limit the inflammation, and long-term help reduce inflammation and improve your healing process. And then step number 3 is going to be, we're going to add in at-home stabilization exercises. Now, I can adjust you all day, every day in my office, but unless you're doing something at home to help strengthen the muscles around the pelvis and lower back, your problem's just going to keep returning into the future. So we're going to add in exercises like the bird dog, like a prone plank, like a glute bridge. All of these muscles are designed to strengthen the muscles of your core, strengthen the glute muscles that attach your pelvis. So this is going to hold the corrections that we're making through adjustments in place to give you long-lasting pain relief. So with our 3-step method of finding the root cause and correcting it, treating inflammation, and adding in stabilization exercises, we're going to help treat your SI joint pain, get you out of pain as fast as possible, and keep it from returning in the future. If you've struggled with lower back pain, buttock pain, leg pain, or difficulty walking, standing, or sitting due to SI joint dysfunction, you now have a deeper understanding of why the SI joint causes so much pain and disability. You also have a clear 3-step approach to treat it, eliminate the pain, and prevent it from coming back in the future. Be sure to look for a chiropractor that delivers this 3-step treatment method to treating SI joint dysfunction. Now, I would love to hear from you. What have been your biggest struggles with SI joint dysfunction? What methods have worked for you and what hasn't? Share your experience in the comments below. If you found value in this video, please like and share it. It helps people discover the channel and the YouTube algorithm loves it. And remember to subscribe to my channel for more tips, strategies to help you achieve lasting relief, improve your mobility, and regain control of your life, all without relying on medications or surgery. In the meantime, if you want to get started with some home-based exercises for relieving SI joint pain quickly, this is the video you should watch next.